So the second thing we looked at was the water tank and water harvesting programs excuse me, that are sustained by the community. And so we've learned that a major problem in Uganda and in many developing countries is just a lack of clean and safe drinking water. And this has been addressed really I think in a really good way at the community level, as organizations have developed ways of building tanks that really depend on the materials available to communities. So, tanks can be built from cement, from bricks, from sand, many different materials based on what the community has at their disposal. And I think that this is really a very sustainable way to allow the community to take control of their water supply and allow them to have access to clean drinking water.
You need water?
I do need water.
I see them push the water. But anyway, so implementation for this project. Again, we were able to go and actually see these builders being trained. And again, they're using both females and males, which I thought was very important. And they have an extensive training. They come down to the city, and it's really organized. And so I like the way it's been worked out. And then they're able to go back to their communities and provide the building of these water tanks. So again, using what's in the community to support the community. In the future, there should be tremendous amounts of access. Hopefully, we'd like to see it expand. But a challenge is definitely with maintenance. As we saw in one of the villages, a mother hadn't cleaned the water tank, and it was just because she didn't have like a screw or a wrench. I'm sorry, I'm not tool savvy. But just maintenance and follow-up to make sure that they can keep up the water tank is definitely going to be a challenge, but we think it can be addressed.
And so that was our main question, is how do you get from point A to point B in training people to maintain and to make repairs to these water tanks, and what kind of effort is going to be made to make sure that that's done.
And specifically from the government, too, right. The government had all any priority to that, so.
No, I'm fine. So the third thing we looked at was really the growth promotion and growth monitoring of infants in communities. And we were able to go out to a community with some of the health volunteers through Coben and see this being done. And a lot of the root of this program is really the high infant mortality rate and high infant malnutrition incidents and problems that go along with that. So a lot of the research that was done to really start this program was a lot of epidemiological studies that were conducted by larger health organizations in Uganda.
And then the implementation, again, was through COVID and their family care workers, who are people who are trained to go out and provide the care in the community. And we saw people were weighing the kids, and then I feel like what that provides, again, was what I was talking about earlier with empowerment for the community and education, because you have these parents who are tracking their child's weight, and care provides resources and support to really monitoring your child to ensure their nutrition.
And so the future of this program, really the things we've learned is that there just needs to be more widespread access to such services, and really get more people involved in volunteering and providing these needs to the communities that they serve.
And in talking to Coben about the family care workers, it seems that there's a huge challenge in motivating them, because I mean, there's no financial incentive for them. Of course, they want to, help their community, but there's a lot of work that goes into doing that, going door to door, and this isn't like our door to door. This is like walking many, many miles to visit these homes, and so motivating their care workers. And then also a challenge was that there wasn't a wait for children over 2, which is, they want to do it for 5 and under, so getting a wait for kids who are older kids would be a challenge. And then questions that we had still remaining, what is the process that's done in the hospitals, within the hospitals, to secure early child development? And then if the government mandates any like checkups or things like that through the country, would be very interesting to know as well. Okay, and we can kind of go through this.
So, I guess to kind of wrap things up, or to start wrapping things up, we thought we might compare a little bit what happens in the United States compared to what we've seen as we've traveled here in Uganda. And the major thing that I was really interested in, that I kind of looked at, was the funding available for both research and then implementation of programs. And I mean, in the U.S., by and large, if you want money to start a program, to maintain a program, it's accessible.
And in Uganda, we've actually been told that like 70% is foreign aid, so there's a lot of dependency and uncertainty about where the money can come, and then it's very earmarked to what it has to go to. So that's one of the main issues. But then on the other side, we saw another issue being with healthcare providers. In America, even though we have like a shortage of physicians, it's nowhere compared to here. And so we have a bunch of trained people who are salaried to do a lot of the things that the volunteers are expected to do in these communities. And so I kind of,
And then the last thing is really just the education in the U.S. is really almost universal for all up through secondary education. And if you want access to education, you have access to it. And we really noticed that in Uganda, while many students have access to it, there's also a lot of things that impede their ability to learn. And whether it's money for tuition or just responsibilities they have in their families that inhibits them from going on into secondary education and onto university, is something that we really noticed.
Okay, so in conclusion, we'd like to say that we appreciate our time here, and we feel that Uganda is really making strides, though, in using all the resources that they have within this country to really meet some of those major needs. One of the things I saw, at least through the projects that we focused on, was a huge connection to the Millennium Development Goals and focusing on, infant mortality and clean water and all these things. I believe it's being strategically approached, and they are, providing universal primary education and moving hopefully to secondary. So we see a lot of these issues that we talked about really being met and having the potential to really, improve this country's access to health care.
And to that, I'd just like to add that I was, very encouraged and really inspired by a lot of the people at the community level and at the larger government level, and their commitment to their communities and the desire to make their communities healthy and educated and have opportunities to make a good living and to be happy. And I was just really encouraged by a lot of the people that I met, and I just would like to say thank you to everybody that I met while I was here, and I learned a little bit from a lot of people. So
with that, I guess we'll open it up for questions. Is there any?
Thank you very much.
Okay.